This is the industry engagement panel. And I have an interesting role in that, although I've been working very closely with Jeff, George, and Nancy to kind of get us this far, I'm also from industry. I'm not an academic per se. And in fact, I just want to be clear. Why are we here? I should have really started with this morning, but why are we here? I know why I'm here, and that's because I throw a lot of sparks out, all these crazy ideas, and occasionally they hit a bit of fuel. In this case, the fuel that got hit was at the SC2 meeting last July, with Jeff and Nancy and many others working on the synthetic yeast project. And it wasn't the right place to kind of propose something like this project, but the yeast community was seeing success, was already thinking about what organism to do next. And they were wanting to do a multicellular organism. And the thing that was really striking to me was that here was really the finest genetic engineering I've seen really in the world on eukaryotes, and there just weren't many people in the room. And I thought that was a bit of a tragedy. The fuel that really got things going was George Church coming on board, Jeff, more conservative, digesting this information coming on board. You're a harder nut to crack, Jeff. Just Nancy Kelly has worked extremely hard getting all the organization going. And I had a really hard job after that, just because as I saw this little core group of people coming together to kind of champion and develop this idea to the point where you're here, I had to go to my boss and say, I think we need to support this. And Autodesk is a public company. My group is the Bio-Nano group. We're developing design and engineering software, but we don't really engage with this type of stuff. And so it was a really interesting question. I said, one, what do you think of this? Organizing something around human genomes. And just the word human is really the part that gets everyone going the most. And I was really surprised because it was the fastest conversation I've ever had with senior management. It was like, yeah, okay, and a gift of $250,000 to help the organizing effort. That was pretty amazing. Where it goes from here is anyone's guess, but we don't personally work with the physical molecule of DNA very much. Design tools to us can be for anything. We've got 3 representatives from industry here that we can have a bit of discussion. This is not a wide cross-section of industry. I think that's, we start off with kind of that framework, but let's just use it as a starting point for thinking about how industry could be involved. I think we have a pretty good idea how academia gets involved in these types of projects, but what is the role of industry? How should industry be involved in this, if at all? So let's just have a round of introductions, starting with Emily.
Hi, good afternoon. For those of you who don't know me, I'm Emily Leproust. I'm the CEO and co-founder of Twist Biosciences. Me and my 2 co-founders, Bill Banney and Bill Peck, forever known as the Bills, started Twist 3 years ago, and we've developed a technology, and now we're commercializing that technology to make DNA from scratch, and we use a silicon platform that has 10,000 wells. In each well, we can make 100 oligos, and now we're commercializing those products as oligo pools for CRISPR-Cas or genome editing experiments. We are making genes, and we're also making libraries for antibody development.
Very good. I'm Kevin Munnelly. I'm the CEO of Gen9. Gen9 is also a DNA construction company. We focus on making DNA of various lengths at in an industrial scale, mega-based quantities for the ultra-high throughput users. This would be a project that would be suitable as a prospective customer of ours. We've been around for about 5 years now, and we focus on innovation in the whole process, from design to the build to the delivery vehicle, such that it plugs and plays into the research paradigms.
And I'm Brian Zambrowicz. I'm the VP of Functional Genomics at Regeneron. And we do a lot of genome engineering. It's very important to our processes. Just as an example, we had our own 1% project, I think you could call it that, when we humanized the light and heavy chain immunoglobulin locus, multi-step process, very complex, and we were able to do that. And I think it speaks to the value of directed genome engineering, because those mice, right, we're taking advantage of 100 million years of evolution. The mice make and optimize our drugs for us. Alirocumab, our PCSK9 inhibitor that was recently approved, the first drug from that. We have 13 other antibodies in clinical development. We have about 200 antibody drug discovery programs ongoing. And again, those mice, when you start throwing an MHC1 and 2 humanized TCR, they're about 1% human genome engineered. And we continue to push the technology to do it better and to automate it.
So let's just kind of go right to the heart of the Human Genome Project, whatever it ends up being called. Is this something that would threaten your business in any way if it was announced scientifically? Or would it be something that would probably be, would you have any reservations if this went public?
No. We'd be excited about it, because I think Regeneron's unusual and really appreciating the value of technology. And we're constantly pushing technology, bringing it in, investing in technology, which is very un-biotech and pharma-like. And certainly, I think things that will come out of this will help us do things better that we already do now. We realize the value that can come out of it. I'm sure we'd like to take part in some way, and I don't see it as any sort of threat.
From our perspective at Gen 9, we think this would be, from a business perspective, a very good thing for the industry to spur on new tools and technologies and new collaborations in the field, things that really take and makes this a leap innovation. So I do think it would be great for the industry, again, from a business perspective.
So maybe I'll say it depends. I think on one end, we want to make cloning obsolete, and so what we want is we want people to see cloning as a digital experiment, where instead of going in the lab, you go on a computer and you type the sequence you want. And so right now we do that for a few KBs at a time, and over time it will grow to tens of KBs and hundreds of KBs and megabase and maybe even gigabase at some point. So from that point of view, having a pool from the market is fantastic, because it pushes the technology in that direction. On the flip side, it depends how it's communicated. Definitely, we have investors, and at some point, we want to go public, and if there is a very strong sentiment against DNA in general, I think that could have a negative impact. However, we are convinced that it's something that's wonderful for the human condition if it's done, if the PR is managed correctly, and so we are very supportive. But it's not without peril. But if we do it correctly, it can be it is a good thing, and people will realize that it is a good thing.
No, I think that makes a very good point. In terms of your platforms today, from the platform that we're working on, again, if we're looking at genomic design, I think Jeff said you wrote in-house software. I'm sure you do software development in your own lab, George. Who wrote your software?
Joel Bader.
Joel, you're awesome. You are. But like, I know that it's going to be a big step up for designing more complex genomes. In terms of your platforms, in fact, it's going to just open whole new doors. How do you see it? How do you see your platforms evolving or changing? And what type of time frame do you think will be necessary? Or is that just going to be driven by kind of the market dynamics?
I guess I'll start. You were looking at me. I think the platforms have to, as Emily mentioned, grow, right? Because DNA, you can't make them in smaller bits. You have to actually make very long DNA if you're going to embark on a whole genome project of this magnitude. And so I think technologies need to evolve in order to make those much longer fragment sizes, whether we're talking about 1 KB or 100 KB megabases, multi-megabases in terms of the synthetic. And that has to be an imperative, as well as the expansion of the sequence space that is synthesizable and verifiable by sequencing. And I think those technologies have to go hand in hand.
Yeah, I mean, it's definitely going to push things. Last November, we announced a deal for 100 million bases of DNA that we are shipping to Ginkgo in Boston. At the time, it was a record, but 100 megabase is not that much in the context of the human genome. And so right now we are making 10,000 genes a month, and end of the year will be at 100,000 genes a month. But 100,000 genes a month, it's only 100 million bases a month, and so there's another few orders of magnitude that we need to deploy. And good news is that silicon scales really well that way, but it's all about, as a business person, you have to make sure that the offer doesn't get too far ahead of the demand, so that it's balanced. But at some point, if we need to synthesize maybe a full 6 gigabytes, why not?
Yeah.
But the one thing that we have to keep in mind about projects like this is that even the Human Genome Project started with one, and it took a long time, right? So even though I do believe that if this does happen, it will spur on all sorts of new synthesis projects, we don't need to have 6 gigabytes per month, year in the first year alone.
And personally, if it just shortens the iterations between syntheses, it will have a big accelerating effect. Do you see this creating more entrepreneurs in the area? Many of the companies at the beginning of SynBio seem to be application focused. Do you see this technology really, or people just being attracted to this area of genome design, really opening up a wider industry space?
Well, I hope so. I think even though it will be easier to be the only synthesis company in the world, competition is good, and so hopefully it inspires people to think differently. And if you go back to the human genome sequencing project, nobody would have anticipated 454, Illumina, Ion Torrent. That's just on the hardware side. It inspired just amazing innovation that you could not have anticipated before. And if we ask everybody to write on a piece of paper today and put it in a time capsule, what do we think will be the big outcome of this? Most likely, we're going to get it wrong, because people tend to overestimate what they can do in the short term and underestimate what they can do in the long term. And I think it's probably the case here, where we can't even think what the great things that are going to come out. So hopefully it inspires a lot of entrepreneurs and a lot of startups.
I think the things in putting it together are one thing, but the new capabilities will spawn all kinds of innovation, right? When we humanized the immunoglobulin locus, really replacing the mouse with human over megabases, it was because the technology just became available that you could feasibly think of doing that. As these technologies come along and there's new, more rapid ways, more sophisticated ways to do larger modifications at a time, people will start thinking of things that they never would have dreamed of because they weren't possible with the technology as it was. And that's how technology works, right? Technology, the technology part is great, but it spawns all kinds of things because it allows people to think and do things that they couldn't have done before without it.
In one of my early conversations with Jeff, you mentioned that you have the capability to write 1 million base pairs, but that most people aren't thinking in those terms yet. This is I think speaks to why a grand challenge can be so important. It just sets a whole new scale of thinking and dreaming, perhaps.
Absolutely, but you've also heard things like Ginkgo. You heard about a biofoundry today, City in the foundry at Imperial and Edinburgh. So people are designing systems to get ready to scale up the construction efforts to, potentially genome levels, or in the case of yeast, already for genome levels. So technology is coming along in this area, and I do agree with both of my colleagues here that this will spur on even further innovation in measurement, in the design field, and in the construction field especially, as well as novel chassis, hosts, vectors, transfer systems.
Yeah, it seems like there's going to be a lot of ancillary development in R&D. How does this affect your business at all? Like, you're a public company. Do you? Yeah, I'm really curious as if this really directly would affect your business, or if it would be something that maybe you'd just participate as a sponsor in.
I think we'd be probably interested in participating as a sponsor or playing some research role as well. Again, I think we have an interest in cutting edge technology and an appreciation for what it can bring you. It can allow you to do things that otherwise you wouldn't do, and it can open up avenues that would otherwise never open up. And so I think, again, I say that I think we're a little unusual in that sense, in that we invest heavily in technology, whereas a lot of companies try to get rid of or outsource technology, and I don't think have a full appreciation of that value.
I've pretty much run through the questions that I'd prepared. I'm going to open it up to the audience. I want to be very clear, though. This project, we've had a number of discussions. This project is really about cell technologies. Companies have a lot of limitations. I think academics end up pushing the boundaries in exploring these types of areas. So let's keep it kind of focused on industry and how we might engage with this project and academic work. Any questions or comments relating to engaging with industry over the next decade? How we might go about this, or how we should go about this, or is it necessary? Jake.
So this might be a terribly naive question, but whenever I see synthesis in terms of the gene sequence. But when we're talking about putting things into cells, we're actually talking about chromatin and the entire world of packaging in a eukaryotic organism. Can any synthesis companies out there actually deliver things in that chemically packaged context?
So, speaking for Twist, we can't at this point, and you need to methylate and package. I don't know if we have someone from synthetic genomics here. If someone does it, they may be the ones doing it. But yeah, we can't do it at this point. But that's why I was talking in terms of the market pool. If there's a market pool, then we'll put our mind to it, and we have the best engineers and scientists. And if there's a demand, we'll do it. Maybe one of the things we'll develop first is a PCR that keeps the methylation state. I don't know. There's lots of things that can be done. But
why do you ask? Because I guess I look at it as you can modify huge chunks of the genome, and they can behave exactly as you would predict they would. In other words, all that can come together if you add the right, if you're sure the right components are there. The difficulty is often making sure you have all the right components. So I think if there's software that's developed to make sure when you're modifying huge regions that you're not missing things or don't completely understand what's going on, that can help. But in general, I think those components, it's surprising how well they can come together and package things the way they need to be.
So your position is that if you just get the DNA sequence right, then all the chromatization stuff will just kind of happen?
Well, I'm not saying if you do the whole genome, but I'm telling you if you do it chunk by chunk, I believe large chunks will behave appropriately, and you can do it chunk by chunk. And that's probably largely the way you're going to have to do it to begin with. I mean, I'm naive, but I would guess.
I think that's a radical hypothesis.
So Jake, in yeast, it's not a radical hypothesis at all. It's a proven fact that, and we've known for years that you can take individual genes, segments of chromosomes and so on, and simply put them on plasmids, and by the time the yeast colony has grown up, it's behaving more or less as the normal gene does. And yeast, yes, although yeast doesn't have DNA methylation, it has silent chromatin. So I do think for yeast, it's very clear that all the information you need is in the primary sequence. Now, when we move to mammals, I totally agree with you. We know a lot less, but I think if you start from an embryonic stem cell or an early stem cell like that, and you assure that the cells go through their normal developmental trajectory, I think the same, again, I don't find it to be a radical hypothesis, and I think you would agree with me at Regeneron that it all comes together and works as it should.
Mark.
Thanks, and welcome. Thank you guys for doing this panel. What about the hard parts to synthesize? How can you talk about roadmap for things that have been traditionally challenging, simple sequence and homopolymer repeats, and at least anecdotally, I know that the ability to get an arbitrary sequence back from commercial synthesis is not homogeneous. Where do we stand, and what does that look like? And do you go, when you're alone in a room, are you scared about that?
That's a great question. I'll field it first if you want. I'm happy to also let you answer that. But I think it's true. There's some challenges with phosphoramidite chemistry. There's some challenges with sequencing chemistry for verification, and then there's some challenges that things that you can perform with phosphoramidite chemistry that make it difficult to assemble. And I think the state of the art in the industry has a very broad range. The industrialization of that is very, very challenging. And I look at some of the things that the yeast group has been able to do in the complex sequences that they have been able to sequence or build and verify is quite amazing. The industrialization of that is the challenge. And I think that we have ongoing initiatives in our shop to drop the GC level. This year we've already come up with something that takes us down to 10% GC. We're going down to 5% GC. We have things that are going to take us up over 90% GC in terms of that content. We've just released protocols that takes us out to homopolymers of 12 across the board. But I think there are other things like repeats, elements, and secondary structures that come into play here. And some of these things are not, at least in our organization, super well defined. And so we are implementing ways to identify these regions that are difficult to make and coming up with new modules to work around those and be able to provide 100% of the sequence. That is an ultimate goal of ours.
And maybe to add to that, the repeats homopolymers, I think we'll be able to get through those. There's some chemical and enzyme tricks you can play, where and I'm not scared at night when I'm alone. But the one thing that's a little bit harder is if you have to go through a cell to get a perfect DNA. What's more intractable is gene toxicity, because it's a perfect gene, it looks beautiful, it sequences perfectly, and then the cell doesn't like it. So then you need a array of cells to go through to find the ones that's okay. So that's probably the biology to me is more difficult than the chemistry or molecular biology.
Biology is always trouble.
Hi, Jim Hollenhorst from Agilent Technologies. One of the great things about HGP 1.0 was the extent to which it drove instrumentation and robotic manipulation of tedious experiments and so forth. And I see HGP 2.0 or HGP-write, I guess I'm supposed to say, as doing the same thing. But I can't predict what are the instruments, what are the bottlenecks. Clearly, synthesis is one area, but I'm interested in what you all think when you prognosticate about the future of robot factories and even business models with cloud factories and so forth, how you see that evolving.
Well, I can make a guess. I think there'll be a point where if you have to go high throughput and do a lot of DNA, at least from where we stand, going to 20 kb is easy. Going to 50 kb, it's not that bad. But manipulating, just even moving around pieces that are more than 50 kbs, that's where I think there is a lot of opportunity for instrumentation. If you want to do it once, you can do a heroic experiment. But if you need to move thousands or hundreds of thousands or millions of 50 kb or above pieces of DNA, that's why I see there is a big need for instrumentation. That's my personal view.
I agree with that, and I think that we can take some lessons from, again, the yeast 2.0 and some of the assembly methodologies that were taken from there, and some of the robotics and automation that have to be more integrated in with the whole process and that are application specific. And I think that we will start to see more of those protocols and more of those integrated systems come onto the market with projects like this, because they have to be tied together, and I think that that's a really important point.
Hi there, Ruha Benjamin, Princeton University. I was hoping to put this panel in conversation with the one at lunch and the one coming afterwards, thinking about how to sort of pool our expertise in the way that we're doing, but actually try to bridge some conversations across panels. So I wondered, from your perspectives, both as individuals and also from your companies, what are the ethical issues, the social issues that you care about? So if you had to frame the kind of LC discussion, how would you frame it? What do you think we should be talking about, as opposed to just getting our cues from those who are sort of trained as bioethicists, let's say?
Maybe having a directed, there's nothing like having a directed project, an outcome or question you're trying to answer, big picture, that can bring people out of the clouds of this or that could theoretically happen. And maybe even the average person then can appreciate the value of what you're trying to do. And so maybe you have your goal, you want to construct a genome, but maybe you should have a goal within that can capture people's imagination, right? We were humanizing, the immunoglobulin locus to make drugs to benefit people, right? We can bring people out who've had those drugs, they can talk about the impact it's had on their lives. I think some component of why are you doing it, I mean, that could capture the imagination, could be very valuable.
I think one of the big challenges is in companies and in organizations and academic institutions is that you really have a multicultural society in effect, and people with different, social, religious, economic. They're coming together under one roof, and not everybody shares the same opinion. And so I do agree that having impact statements and people having clarity on exactly what we're doing and why we're going to do it is important. If it's for basic research or if it's for ultimate benefit of the humanity, it's another story. But I do think that those two things are very, very important because I do think that something like this will have a slightly polarizing effect depending on how it's positioned.
Yeah, maybe to add to the conversation, we do this, to starting a company, there's really two reasons. One is to create economic value, and the other is to change the world. And so we are all in it to change the world for the better, and that may sound a little bit arrogant, but it's what it is. And the key is to communicate, and it was mentioned earlier, communicate the risk benefit. I'm from Europe, and people don't want to eat GMOs, but they can't even articulate why, except that they think there is a risk to them and that someone else gets the benefit. But if they get cancer and they offer their drug that's GMO, there is no hesitation. They want to take the drug because they take the risk. They may die, but they also get the benefit. And so every invention is a coin, and is a bad use and a good use. With a dynamite, you can build tunnels and you can kill people, and with an iPhone, you can communicate with loved ones, but terrorists communicate with each other too. And we're not going to ban iPhones. So the key is to communicate all the positive benefit of what we are doing, as well as the risk. And if we do that correctly, I think the technology can be embraced by the vast majority. I think we should be clear that we'll never convince everybody. So there'll always be a small vocal minority that we can't bring along to see the larger vision. So the key is to make sure that the vast majority sees the benefit and supports the great work that we are doing.
I've got someone over here.
Ellen Jorgensen from GenSpace. This is a question for Brian, and I have a disclaimer. I was at a CEO breakfast with Neil Stahl a couple of weeks ago, so I'm even more rabid Regeneron fan than I was before. It's a very unusual company in that it seems to invest a lot in basic research and infrastructure more than a lot of other companies that are doing drug development. And you have all these interesting systems. You've just done a deal with Intelia. You're obviously very interested in the human genome. How much of that technology, in terms of participating in this project, how much of that technology would be shared Velocihumans? I don't know.
No, that's why I said I think there'd be an interest in perhaps taking part in a project like this, because I think we have a real interest in cutting-edge technology, pushing it, but pushing it with real hands in the projects.
Like the Velocimouse technology.
Yeah, I mean, sure, I think of it simplistically like that too. We do it piece by piece. That's what I'm saying. When you do it piece by piece, it all comes together. I'd imagine that's the way you do the human genome. We've automated it to do the mouse piece by piece. I mean, we've modified huge portions at this point, whether it's for humanizations or knockouts or point mutations or modifying whole portions to humanize to make better drugs. And yeah, I think we could bring to bear those sort of technologies to be helpful. Certainly, and then we would learn a great deal as well from people who are doing things elsewhere. No, I mean, we've published much of what we do, right? I think there's nothing proprietary. The capability of doing it on scale and automating it, I think that's translatable. And so I think that there's ways to work well together.
Hi, Mike Chow from Harvard. Curious, we're now approaching where we would, the $1,000 genome sequence, and if George's numbers were, if I extrapolate from his numbers earlier, I think if I asked you guys to synthesize the human genome today, it would be $100 million, but clearly that's not possible for other technical reasons. Do you guys see the cost of genome synthesis continuing to drop? And if not, is there a plateau? Like, what are the, I guess in the Human Genome Project, one of the things we could have focused on more is technology development instead of ramping up ABI sequencers as early as we did. We could have tried to push harder on technology, less on robot automation. And what are the things you guys see as the hurdles and things that we need to solve at a strategic level to do this project if we were to do it today? I mean, what do we need to do to get there sooner?
It's a great question. You know, I'll answer from my perspective, and I think we have slightly different views on it. But I don't think that there's a floor limitation in the shorter term. I think that the costs can come down, and it's the case with our company right now. So much of it is volume related. If volume goes way up, our costs come way down, and we can pass that on, to the consumers and to all the researchers. I think one of the challenges becomes at what length does that cost come down. We always talk about a cost per base pair, but it's never in the context of a length. If in the context of 100 mer is very different or very different in the context from a base perfect 10,000 mer. And so I think that that's something that we have to start getting used to talking about, because we want to have a context, right? Even a $1,000 genome is not a fully complete genome read too. And I do think we want to be talking the same language when we talk about this. But having said that, our goal is to have a technology that scales both down in terms of cost, up in terms of volume, as well as length and sequence space to enable projects like this. And so one of our goals would be to keep the cost coming down, and we will keep working very hard to keep doing that and trying to stay ahead of that curve.
And maybe to add one axis to it, in addition to length, is also time. If you want something delivered in 5 days, it can't be the same cost that if it delivered in 10 days, 20 days, or if you say, I don't care, give it to me in 6 months. That has very different economics. So length, time have a huge impact, but like in sequencing, as the number as the demand for sequencing grew, the cost went down, and as long as there is more things to write, they'll be, we'll be pushing each other. There'll be newcomers, and at the end of the day, you're the beneficiaries, and the world is the beneficiaries, and that's why competition is so great. It's because it makes for better product, cheaper product. So it's great for you, and for us, it makes bigger markets. So it's a win-win.
We're going to wrap up the session a little early. We'll get back on schedule at 4:15. So maybe one or two more questions if they're out there.
Thanks. One point I wanted to make is in between my yeast work, I did about 20 years of clinical development, and there's a term, benefit, risk, and uncertainty. I think what we're talking about here is almost 100% uncertainty. I don't think anybody could say with any certainty that there's a risk. So I think that's something important in terms of the way we discuss these issues. What I wanted to ask was, in Regeneron's experience, doing the antibody engineering when you did it versus now, how much faster, cheaper, easier would it be based on new technology, new DNA synthesis, new techniques, and everything else?
Not a lot. Because I don't think there's been some advances that help us, right? Certainly we'd be slightly more efficient, but we're still at the point where probably the largest modification we make as far as serial modifications is probably in the 400 KB range. So, I mean, you're still doing a lot of steps if you're trying to modify, 8 megabases of DNA.
And that's in how many years then? So that's over a span of how many years then?
What's that?
Would be there was no change basically in the kind of technology that...
Oh, there's things, I mean, look, everything you could do before, you could do better with CRISPR, for instance, right? There's nothing like a double-strand break to help you out, right? So there's efficiencies, but as far as, really crushing down the length of the process. For us, since you have to do it in an embryonic stem cell and you have to do it serially, you have to make sure the stem cells can produce a mouse. There's still some time limitations that we wouldn't get around yet.
Okay, one more question.
Ken Way from MIT. This really follows very much on the question just before. There is a lot of uncertainty that often triggers or exacerbates both regulatory scrutiny and public concern. If you could pick one area of uncertainty that would make your lives better were it to be mitigated, addressed, what would that area be, and who should pay for the research that reduces it?
Maybe I can start with for us the biggest area of uncertainty is around screening of the sequences that we get. So we screen sequences, and the way it works is you get a top hit, and then you have to search that top hit, maybe a pathogen, and you have to look into whether it's a housekeeping genes, which is fine, or if it's really the toxin gene. And so I think the way that's done is that's how it is. And so we'll do it, but there's probably a better way to do it, which will be to create a database of all the actually bad sequences, and then you can screen against those and do it in the open. Because right now the database is closed, the algorithm to search are closed as well. And I think what the internet industry has shown is that if you're open, if other people can stress test you and find bugs that make your algorithm and your screening better. So I think my wish would be if there was a database of all the forbidden genes and algorithms that all the synthesis companies are using to screen against those, and everybody is open, everybody can look, everybody can test. That would be my dream. I think that. Yeah. So who should pay for it? Will contribute some of it.
I think right now the gene synthesis industry kind of self-funds that whole initiative. So, but I do think it's more of a global issue. So, but it's a wonderful point. I would also say, Ken, MIT just raised another $5 billion. So, if you want to kick in some from your budget.
It actually sounds like something that would fit well with blockchain technology as well. Just kind of.
Because that's really one. If we try, so first is the right thing to do. Make sure we don't do something that's dangerous and get somebody harmed. But I think it also goes a long way in assuaging the fears of the general public. It may not convince the small vocal minority, but one, it's a great thing to do, and two, I think it helps making people less worried about biology, because there's this feeling that a computer, you can unplug it, but there's this fear that biology is alive and that the bug is going to take over. And so that's a rational fear we have to get over.
In closing, thank you very much for your participation and thoughts today. One last thought. It's a different time now than when the Human Genome Project launched. There's a lot more public-private cooperation than ever before. I think there's a lot more pre-competitive space. We understand that these are foundational technologies in many ways that industries can be built on. The internet has changed a lot of business models and a lot of thinking and made it easier to collaborate than ever before. I hope that we can have a really strong partnership with all different types of organizations as we move forward and explore this and talk about this. Anyway, thank you very much, and thank you for your participation.
Thank you, Andrew.